Coloradans are heading to the polls today to vote in this year's primary election. The November elections could have a huge impact on several health-related issues. Joining us now is our 9 health expert, Dr. Payal Kohli. We talked to you a little bit about this a week ago. We're staying out of the political side of it. But reproductive rights are a big issue right now. What does it mean for medical providers?
Yeah, so many different aspects of reproductive rights that I think will be important in this particular election and voters will have to think about. So first, of course, is the access to abortion, which we've been talking about here in Colorado, not as much of an issue, but we are seeing an influx of women coming in to get abortions, as well as more medical abortions, taking pills to induce an abortion because of the recent changes that have occurred. We also talk about access to contraception. So coming in just a few weeks is the first over-the-counter oral contraceptive pill, which is again part of reproductive rights. And then we talk about maternal health. So actually pregnant women have been having worse outcomes recently, with higher moms dying than ever before. And that's become a real political issue as to why. Is it access to care? Is it access to prenatal care that's doing this?
It's put many doctors and caregivers in a terrible spot. We're in a tug of war politically. They're the rope. They're just getting pulled in both directions. You look at things like what's happened with vaccinations.
Absolutely.
The idea that vaccinations were not a political thing, and they became one certainly during COVID and continue to be one. You certainly look at things like IVF and reproductive rights and the like. So from a medical standpoint, this position is not what you signed up for.
It's not, and nor did I know when I was going to medical school and getting my MD that I would be in a situation where I was so helpless, where as a physician, as a healthcare provider who operates on science, I would be unable to offer my patients so many different things. Vaccines is a great example, Tom. I still have patients today, and we've seen the statistics that refuse to get the COVID vaccine because of how political.
Or others as well now. That's become another issue as far as some of the basic
RSV
vaccines
and others.
that are presumed. So when you think about this now, because for you to become a doctor, you have to go through not all those years of education, but a series of tests. And many people are talking about cognitive testing also for our 2 main presidential candidates at this point, that push and pull and call each other names and things like that. At least, I mean, those who support them do. Is there a baseline that you can imagine we could use if you ever said we want to have some sort of cognitive test for people to pass? Because people get to cherry pick their own test, if you will, or their own level of acceptability.
There is indeed, although no formal guidelines have been published by the medical societies, but this is certainly where we're headed. But when we think about professions where, you know, your actions influence one or many more lives, we do have to have a minimal mental threshold and a minimal physical threshold. So I'm talking about pilots, I'm talking about surgeons, I'm talking about truck drivers, and certainly political leaders as well. We also know that there is an age-related cognitive decline. So an 81-year-old brain, our president is 81, is never going to be as sharp as a 50-year-old brain, and so on and so forth. And assessing that age-related cognitive decline, there are a number of objective tests that we can use. And to your point, we can't cherry pick those tests. You really have to go through all of them and have formal neurocognitive testing in order to decide if somebody's sharp enough to do their job. Now, that's going to look different for every person. A truck driver has to have a different level of mental acuity than the president, than a heart surgeon, but it certainly is something that we do need to assess.
Yeah, and we do demand it and would hope that a pilot or a surgeon would be in that situation, but it just goes into that political angle. So your advice would be, no matter what your personal policies are, read before you vote, but voting itself is a good thing for us.
It's so good for us. So deciding who to vote for can cause us stress, but when we actually vote, it creates engagement. It gives us control back, which is the root cause of many of our psychological distress, depression, anxiety, substance use. And so getting that engagement, that control back, it's a social thing, it creates a community, and it helps us with our resilience. So for studies have shown in college students who vote, who are more politically active, not only are they happier, they're more resilient as well.
So as an old guy, I would say it always felt more that it used to be people voted for things, and now I get the feeling that a lot of people are voting against things. So while you talk about that being something that does feed you as far as you feel good about who you're voting for, it seems to me, and maybe it's just the world we live in now, or at least maybe my view of the world we live in now, that more people are voting against things they don't like or people they don't like. And I wonder if that may have changed the way you say we feel about voting.
I think you're right about that. I think we've become more negative as a society and as a population, but even voting against something does create that same level of sort of endorphin release, dopamine hit, because you've expressed your voice. You've taken control of your fate. And what I don't want us to do is to become apathetic, whether it's about medicine or politics, sit at home and complain, but then not actually do something about it. So I think exercising that right to vote, whether it's a positive or negative vote that you're giving, really does help us feel like we've gotten at least our voice heard.
Yeah, if we
Super
want to
Tuesday.
complain, we call our doctors and complain.
right.
We just complain. I
Or-
got this ache, I got this. And
Poor doctors, poor doctors. Of course, you can see much more with Dr. Kohli. Go to 9news.com/Dr. Kohli. Thanks for coming by.